And are my slides going to move along is the question. So has that
Yes,
moved
they
along?
will.
Just check. Brilliant. So I am just going to talk generally about what's happened since we've run the Green Team competition. So we've just literally 2 weeks ago had our award ceremony for our third Green Team competition at Northampton General Hospital. We first started doing this about 4 years ago. I managed to get some charitable funding to run the competition. For those that don't know us, Northampton General Hospital is just a medium acute district general hospital in the Midlands in the UK. And we have the normal district general hospital functions such as 16 operating theatres, stroke rehabilitation, cardiac, all the normal things. So I'm going to run through a few of the competition entries that we've had, not this year, but in the last couple of years, and talk about what's happened since. But so in the three that we've run, the first year we had 4 entries that made it to the end, and we calculated about £71,000 saving, but 53 tonnes of CO2. The next year we had 6 competition entries that went all the way to the end, and then this year we've just had the 4 that made it to the end because it is quite intensive, but they've all been absolutely brilliant entries. And the main thing about them, apart from not costing anything other than CSH, has been that they've made big improvements for the patient and also for the staff. So in the first year, the winner was the HIV service that operates on our site, but is in the local community trust. And they had a couple of aims. So they wanted to change their model of care and reduce the number of patients coming on site. And then they thought that would free up some nursing time. So they did this by separating their patients into stable and non-stable cohorts. They thought they'd save about about 350 hours of band 6 nurse time. So they put all this in place, saved £45,000, but going on from that, they actually had a lot more patients, and they had 1,000 patients. Unfortunately, one of their consultants, there were only 2 of them, passed away, and I was told that, if we hadn't put this in, we couldn't have managed. Because they've had more patients, they've had 500 hours of band 6 nurse time as well that they've managed to save. Only 3 in all this time have come off the pathway. One of them was because they stopped taking the meds, and one was deported, and I can't remember what the other one was. So there's now an HIV SIG, and the national guidelines are going to change as well. So with the Centre for Sustainable Healthcare, they've recently brought out a shiny new booklet about how to make HIV services more sustainable. We gave them £500 as their prize money, which they used to buy reusable tourniquets, which have been in place across their service. And they're now moving on to look at reusable specular and decontaminating those with UV. So they're really moving on and pushing forward with what they're doing, just in this one tiny service. So we've gone from affecting 1,000 patients to potentially 100,000 patients across the NHS, just by saying you don't need to come in twice a year, whether you need to do it or not. We were just bringing them in just because habits in the NHS. I've highlighted this one as well. So this is our critical care team, and they wanted to look at PPIs and whether they could reduce the time patients in critical care that came from surgery were on PPIs. And I highlight this because it looks like it was a tiny cost saving in comparison to the 20-odd thousand or 45,000, sorry, that Lynn had in HIV. And they really didn't know what to do. And they were about 2 weeks after everybody else starting. So they did have a cost saving. They also looked at the dreaded IV to oral as well. But what Leanne has now done since then is she's completed a Florence Nightingale Fellowship. She's delivered a workshop to the local quality network. She arranged a whole day for the quality care, quality improvement, critical care quality improvement group across the Midlands. So a whole day talking about sustainability. She's completed a project reducing waste in theatres. She has got a load of other projects on the go. She's joined our Greener Nursing and AHP group, and she was featured in the Critical Care Sustainable Recipe Book as well, that project. So IPC were our runners-up last year. So this was the second time they'd entered, and they had a continence project. So they were trying to reduce the number of patients routinely incontinence products by improving staff education. And the year before that, they'd done a BPPE-free project. So their aims were quite big, and this was with tissue viability and also the falls department. And as you can see, just on a little bit, because we do a poster for everybody as well, they reduced infections, bloodstream infections caused by catheters. They saved money, and they saved carbon. And also it was better for patients not to be put, I mean, the continence products were huge. It was like having an adult nappy, even if they just needed a pad, a small pad. So what have they gone on to do since? So because of this project, they now have a continence nurse that's been employed. They have linked nurse meetings run by this continence nurse. We have an elderly ward that's agreed to go and be a flagship ward, and they're going on to be pad free. They've not started it yet, but they're hopefully going to. There's a lot more training available. They use their money from the PPE project because they came second, so we give them £250. They use that to buy smaller pads for their patients as part of this project. And then Jasmine, who was one of the team that did the PPE project, entered this year, and she won it this year with a decaffeinated drinks project. So she replicated what a couple of other trusts had done as well, by moving to decaffeinated drinks in an elderly ward. So they reduced patients toileted in the night by a fifth. They reduced urinary incontinence by a third. Patients sleeping for more than 6 hours was increased by 40%, and they've reduced violence and aggression and falls in the 3-month period by more than 50%. So it's enabled and it's given them the confidence to go on and do other things. Ice Theatre, they wanted to look at the reusable options. They want to go to reusable eye drops as well, but pharmacy, even if IPC say yes, pharmacies say no at the moment. And so they switched some scissors and forceps to reusables from single use. This has been featured in the Design for Life, the Department of Health, in their roadmap as a case study. The team up there are reconfiguring more of their packs. They'd already done some. Hand Therapy, who won last year with a patient model of care change, they've used that example and they've now gone to reusable forceps and scissors for the dressing. And I've still got in the back of my mind about the eye drops. And then renal pharmacy, that was a project done by Jamie, and she wanted to reduce the time that pharmacy dispensers spent checking the medication returns boxes by educating ward staff about what could and couldn't go back to be reused, but also the time spent dispensing patients' own medicines or patients' own drugs pods. Again, she had a brilliant outcome from this, but she's now gone on. So she is starting to look at other ways she can do some more research into this area. She's had posters at pharmaceutical conferences. She won the Director's Award at the Quality Improvement Awards internally, and she started this patient-owned drugs project. So she's looking at one other ward at the moment onto the cardiology ward, and so far it's saving £4,000 and a ton of CO2 every month. So she's now got a patient forum set up, and she started to take their views on, well, how would you feel if you were asked to bring in your own meds, or how would you feel if we didn't dispense meds that you've got at home, and try and reduce that duplication and that also the time, not just the medicines waste. So it's the first step on our research journey. She's interested in doing a PhD in sustainable pharmacy. So hopefully she's going to step up and do quite a bit more. She's also completed, they don't run it now, I don't think, but the Sustainable Healthcare Leadership along with 2 other pharmacists, and comes to our SD committee. So from the last 2 competitions, we've had changes to national guidance. We've got more reusables coming across the trust. We've got a Green Nurses Network, an AHP network. It's been featured in 2 national showcase books, the Recipe Book and the Design for Life. We've had posters winning 3 Quality Improvement Awards internally. Our Associate Director for IPC, was the RCN Green Nurse of the Year in 2023. We've been highly commended twice in the HSJ Awards. I warn you, one of this year's projects, either one from surgery or the caffeinated drinks project, is going to win this year. We've got team members on the Infection Prevention Society SIG, and we've got on the HIV SIG as well. So I just think for every two projects we do, we seem to have someone who goes and takes these further. And of course, now we have a growing network of sustainability leads.